Question 1. A 50-year-old male presents with a history of fatigue, polyuria, and blurry vision. His lab results show blood glucose of 350 milligrams per deciliter, and HbA1c is 9.5%. Which of the following is the priority intervention? A. Start oral anti-diabetic medications. B. Administer intravenous fluids and insulin. C. Encourage lifestyle modifications. D. Recommend over-the-counter blood sugar monitoring. Answer: B. Administer intravenous fluids and insulin. Rationale: with blood glucose levels elevated above 350 milligrams per deciliter, the patient is at risk of diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS. Immediate insulin and fluid replacement are essential to prevent complications. Question 2. A 60-year-old woman with a history of hyperparathyroidism presents with fatigue, depression, and increased thirst. Her serum calcium level is elevated. What is the next step in management? A. Administer calcitonin. B. Prepare for parathyroidectomy. C. Start intravenous fluids. D. Administer a diuretic. Answer: B. Prepare for parathyroidectomy. Rationale: hyperparathyroidism often requires surgical intervention, parathyroidectomy, to remove overactive parathyroid glands. Calcitonin and intravenous fluids can be used temporarily to manage hypercalcemia, but surgery is definitive. Question 3. A patient with hyperthyroidism is being treated with radioactive iodine. What should the nurse emphasize in patient education post-treatment? A. Stay isolated for several days to prevent radiation exposure. B. Immediately discontinue thyroid medications. C. Increase protein intake to boost metabolism. D. Avoid taking any form of thyroid replacement. Answer: A. Stay isolated for several days to prevent radiation exposure. Rationale: after radioactive iodine therapy, patients are advised to avoid close contact with others to minimize radiation exposure. Discontinuing thyroid medications, altering diet, or stopping thyroid replacement is not recommended immediately after treatment. Question 4. A 40-year-old male with a history of uncontrolled diabetes presents with fruity-smelling breath, nausea, and tachypnea. His blood glucose is 500 milligrams per deciliter. What is the most likely diagnosis? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Thyroid storm. Answer: A. Diabetic ketoacidosis, DKA. Rationale: DKA is characterized by elevated blood glucose, fruity-smelling breath, nausea, and tachypnea. It typically occurs in type 1 diabetes due to insulin deficiency and ketone production. HHS presents without ketosis. Hypoglycemia presents with confusion and sweating, and thyroid storm involves hyperthyroid symptoms. Question 5. A 30-year-old woman presents with irregular periods, weight gain, and hirsutism. Her testosterone levels are elevated, and ultrasound reveals multiple ovarian cysts. What is the most appropriate treatment? A. Oral contraceptives. B. Insulin therapy. C. Levothyroxine. D. Methimazole. Answer: A. Oral contraceptives. Rationale: oral contraceptives are often used in PCOS to regulate menstrual cycles, reduce elevated testosterone levels, and manage symptoms like hirsutism. Insulin therapy is helpful for insulin resistance, but not a first-line treatment for these symptoms. Question 6. A patient with Addison's disease presents with low blood pressure, dizziness, and a decreased appetite. What should the nurse prioritize in the management of this patient? A. Administer IV fluids and corticosteroids. B. Encourage increased sodium intake. C. Administer a diuretic to decrease fluid retention. D. Initiate thyroid replacement therapy. Answer: A. Administer IV fluids and corticosteroids. Rationale: Addison's disease results in adrenal insufficiency, leading to low cortisol and aldosterone. Immediate administration of IV fluids and corticosteroids is critical to treat hypotension and electrolyte imbalances. Sodium intake may be increased, but fluid resuscitation and corticosteroids are immediate priorities. Question 7. A patient diagnosed with hyperthyroidism is undergoing treatment with methimazole. Which of the following is the most serious side effect of this medication? A. Granulocytosis. B. Weight gain. C. Hyperkalemia. D. Hypotension. Answer: A. Granulocytosis. Rationale: methimazole can cause agranulocytosis, a serious side effect that reduces white blood cell count and increases the risk of infection. Weight gain, hyperkalemia, and hypotension are not common side effects of methimazole. Question 8. A patient presents with low blood pressure, hyponatremia, and hyperkalemia. A serum cortisol level is low. What is the most likely diagnosis? A. Cushing syndrome. B. Addison's disease. C. Hyperaldosteronism. D. Hypoparathyroidism. Answer: B. Addison's disease. Rationale: Addison's disease is characterized by adrenal insufficiency, leading to low cortisol and aldosterone levels. This results in low blood pressure, low sodium, and high potassium levels. Cushing syndrome involves high cortisol. Hyperaldosteronism increases sodium and water retention, and hypoparathyroidism is associated with calcium imbalance. Question 9. A patient with type 2 diabetes is started on metformin. Which of the following is an important consideration for the nurse in monitoring this medication? A. Risk for hyperkalemia. B. Risk for lactic acidosis. C. Risk for hypoglycemia. D. Risk for hypercalcemia. Answer: B. Risk for lactic acidosis. Rationale: metformin can cause lactic acidosis, especially in patients with renal impairment or dehydration. It does not typically cause hyperkalemia, hypoglycemia, unless used with other medications, or hypercalcemia. Question 10. A patient with a history of hypertension and hyperlipidemia presents with sudden chest pain, shortness of breath, and dizziness. His blood pressure is 180/110 millimeters of mercury, and his heart rate is 120 BPM. What is the priority action? A. Administer antihypertensive medications. B. Place the patient in a sitting position. C. Administer pain relief and monitor vital signs. D. Prepare for potential cardiac workup and monitoring. Answer: D. Prepare for potential cardiac workup and monitoring. Rationale: the patient's symptoms and elevated blood pressure suggest a possible acute coronary syndrome, ACS, or hypertensive emergency, requiring immediate cardiac monitoring and workup. Antihypertensive medications may be used after further evaluation, but the priority is addressing the potential cardiovascular emergency. Question 11. A 25-year-old male presents with excessive thirst, polyuria, and hypernatremia. His serum ADH levels are low. What is the most likely diagnosis? A. Diabetes insipidus. B. Diabetes mellitus. C. Hyperthyroidism. D. Hypothyroidism. Answer: A. Diabetes insipidus. Rationale: diabetes insipidus is characterized by a deficiency of antidiuretic hormone ADH, leading to excessive urination, polyuria, and increased thirst, polydipsia, with hypernatremia due to water loss. Diabetes mellitus involves hyperglycemia, while hyperthyroidism and hypothyroidism are unrelated to ADH function. Question 12. A 45-year-old woman with a history of obesity presents with hirsutism, acne, and irregular periods. Her testosterone levels are elevated. What is the first-line treatment for this condition? A. Spironolactone. B. Oral contraceptive pills. C. Metformin. D. Insulin injections. Answer: B. Oral contraceptive pills. Rationale: oral contraceptives are first-line treatment for managing elevated testosterone levels, regulating menstrual cycles, and reducing symptoms like acne and hirsutism in polycystic ovary syndrome, PCOS. Spironolactone may be used for hirsutism, but oral contraceptives are the preferred initial therapy. Question 13. A 58-year-old female with a history of osteoporosis presents with a fractured wrist after a fall. What is the priority intervention for the nurse? A. Administer pain medication and immobilize the fracture. B. Teach the patient about the importance of weight-bearing exercises. C. Refer the patient for a bone density scan. D. Administer a bisphosphonate for osteoporosis. Answer: A. Administer pain medication and immobilize the fracture. Rationale: immediate care for fractures includes pain management and immobilization. Bisphosphonates are used for osteoporosis management, but are not the priority in acute fracture care. A bone density scan may be done later, and weight-bearing exercises can be part of long-term management. Question 14. A 70-year-old male with a history of type 2 diabetes is admitted with a blood glucose of 550 milligrams per deciliter. He is confused and has decreased urine output. What is the most likely diagnosis? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Thyroid storm. Answer: B. Hyperosmolar hyperglycemic state, HHS. Rationale: HHS is characterized by extremely high blood glucose, usually greater than 600 milligrams per deciliter, with altered mental status and decreased urine output, often seen in older adults with type 2 diabetes. DKA typically presents with ketosis and acidosis, while hypoglycemia would present with confusion and shakiness, not elevated glucose. Question 15. A 50-year-old male with a history of hypertension presents with headaches, sweating, and palpitations. His urine catecholamines are elevated. What is the most likely diagnosis? A. Pheochromocytoma. B. Hypertensive crisis. C. Hyperthyroidism. D. Cushing syndrome. Answer: A. Pheochromocytoma. Rationale: pheochromocytoma is a catecholamine-secreting tumor of the adrenal glands, presenting with symptoms like headaches, sweating, and palpitations. Hypertensive crisis may present similarly, but lacks the elevation in catecholamines. Hyperthyroidism and Cushing syndrome have different symptom profiles. Question 16. A patient with hyperthyroidism is being treated with methimazole. The nurse should monitor for which of the following serious side effects? A. Agranulocytosis. B. Hyperglycemia. C. Weight gain. D. Hypokalemia. Answer: A. Agranulocytosis. Rationale: methimazole can cause agranulocytosis, which is a potentially life-threatening reduction in white blood cells. Monitoring for signs of infection is crucial. Hyperglycemia, weight gain, and hypokalemia are not common side effects of methimazole. Question 17. A patient with a history of obesity presents with elevated serum cortisol levels. The nurse should assess for which of the following complications associated with long-term cortisol excess? A. Weight loss. B. Osteoporosis. C. Hypoglycemia. D. Hypercalcemia. Answer: B. Osteoporosis. Rationale: long-term elevated cortisol levels, as seen in Cushing syndrome, can lead to osteoporosis due to the catabolic effects of cortisol on bone density. Weight loss, hypoglycemia, and hypercalcemia are not typical effects of elevated cortisol. Question 18. A 25-year-old female presents with irregular periods, excessive facial hair, and a history of infertility. Which of the following tests is most useful for confirming the diagnosis of polycystic ovary syndrome, PCOS? A. Serum testosterone levels. B. Ultrasound of the ovaries. C. Thyroid function tests. D. Serum prolactin levels. Answer: B. Ultrasound of the ovaries. Rationale: an ultrasound of the ovaries showing multiple cysts is key to diagnosing PCOS. Elevated testosterone levels may support the diagnosis, but are not definitive. Thyroid function tests and serum prolactin levels are used to rule out other causes of infertility. Question 19. A patient with a history of hypothyroidism presents with cold intolerance, dry skin, and weight gain. His TSH is elevated, and T3 and T4 are low. What is the priority nursing intervention? A. Administer levothyroxine as ordered. B. Start warm compresses for the patient's cold intolerance. C. Teach the patient about a low-sodium diet. D. Recommend an exercise regimen to promote weight loss. Answer: A. Administer levothyroxine as ordered. Rationale: The priority intervention for hypothyroidism is administering levothyroxine to normalize thyroid hormone levels. Cold intolerance and dry skin will improve with treatment, while exercise and a low-sodium diet may be part of long-term management. Levothyroxine is the immediate priority. Question 20. A 30-year-old female with a history of hyperthyroidism is being treated with radioactive iodine. What should the nurse educate the patient regarding the post-treatment care? A. Maintain strict isolation for 48 hours to limit radiation exposure. B. Discontinue all thyroid medications immediately. C. Begin taking iodine supplements to prevent thyroid deficiency. D. Monitor for symptoms of hyperkalemia post-treatment. Answer. A. Maintain strict isolation for 48 hours to limit radiation exposure. Rationale. After radioactive iodine treatment, the patient is advised to avoid close contact with others for a period of time to limit radiation exposure. Discontinuing thyroid medications, starting iodine supplements, and monitoring for hyperkalemia are not appropriate actions after treatment. Question 21. A 60-year-old woman with a history of hypothyroidism is being treated with levothyroxine. The nurse notes that the patient is experiencing nervousness, tachycardia, and weight loss. What should the nurse suspect? A. Hypothyroid crisis. B. Levothyroxine overdose. C. Hyperthyroid crisis. D. Hypercalcemia. Answer. B. Levothyroxine overdose. Rationale. The symptoms of nervousness, tachycardia, and weight loss in a patient on levothyroxine suggest an overdose, which can cause hyperthyroid-like symptoms. Hypothyroid crisis involves severe fatigue and low body temperature, while hyperthyroid crisis would require more severe symptoms. Question 22. A patient with a history of diabetes insipidus (DI) is admitted with severe dehydration. What is the priority treatment for this condition? A. Administer vasopressin. B. Provide oral fluids. C. Start insulin therapy. D. Administer corticosteroids. Answer. A. Administer vasopressin. Rationale. Diabetes insipidus is caused by a deficiency of vasopressin antidiuretic hormone, and the priority treatment is to administer vasopressin or desmopressin to replace the hormone and prevent further dehydration. Insulin therapy and corticosteroids are not used for DI, and oral fluids alone would not be sufficient. Question 23. A 55-year-old male with a history of obesity and hypertension presents with fatigue, increased thirst, and polyuria. His blood glucose is 375 milligrams per deciliter, and his A1C is 9.2%. What is the most likely diagnosis? A. Diabetes insipidus. B. Type 2 diabetes mellitus. C. Type 1 diabetes mellitus. D. Hyperosmolar hyperglycemic state, HHS. Answer. B. Type 2 diabetes mellitus. Rationale. The patient's symptoms, along with the elevated blood glucose and A1C, are indicative of type 2 diabetes. Type 1 diabetes typically presents in younger patients and is characterized by insulin dependence, while diabetes insipidus involves a deficiency in ADH. HHS is a complication of uncontrolled type 2 diabetes, but is not the primary diagnosis here. Question 24. A 35-year-old female is diagnosed with a thyroid nodule. A fine needle aspiration reveals a benign result. What is the nurse's priority teaching for this patient? A. Prepare for thyroidectomy. B. Regular follow-up appointments are necessary for monitoring. C. Start thyroid hormone replacement. D. Administer radioactive iodine therapy. Answer. B. Regular follow-up appointments are necessary for monitoring. Rationale. A benign thyroid nodule requires regular monitoring, including ultrasound and follow-up evaluations. A thyroidectomy is only required if the nodule is malignant, and radioactive iodine therapy is used for hyperthyroidism or cancer, not benign conditions. Question 25. A 50-year-old male with a history of Cushing syndrome is undergoing treatment with ketoconazole. Which of the following is the nurse's priority in monitoring for potential side effects of this medication? A. Liver function tests. B. Blood glucose levels. C. Serum calcium levels. D. Potassium levels. Answer: A. Liver function tests. Rationale: ketoconazole is a medication used to manage Cushing's syndrome by inhibiting cortisol production. A known side effect is liver toxicity, so liver function tests should be monitored regularly. Blood glucose, calcium, and potassium levels are important to monitor, but are not the priority for ketoconazole use. Question 26. A 40-year-old male with a history of hypertension and hyperlipidemia presents with a headache, sweating, and palpitations. His urine catecholamines are elevated. What is the most likely diagnosis? A. Pheochromocytoma. B. Hyperthyroidism. C. Cushing syndrome. D. Diabetic neuropathy. Answer: A. Pheochromocytoma. Rationale: pheochromocytoma is a catecholamine-secreting tumor that causes symptoms like headache, sweating, and palpitations. The elevated catecholamines support this diagnosis. Hyperthyroidism causes weight loss and heat intolerance, and Cushing syndrome involves elevated cortisol, while diabetic neuropathy presents with peripheral symptoms like tingling or pain. Question 27. A 60-year-old female with a history of osteoporosis presents with a fractured femur after a minor fall. What is the priority nursing intervention? A. Administer pain medication and prepare for surgery. B. Teach the patient about calcium and vitamin D supplementation. C. Perform a bone density scan. D. Encourage weight-bearing exercises. Answer: A. Administer pain medication and prepare for surgery. Rationale: the immediate priority for a patient with a fracture is pain management and preparation for surgery if necessary. While calcium and vitamin D supplementation, bone density scanning, and weight-bearing exercises are important for long-term management, they are not the immediate concern in an acute fracture. Question 28. A patient with a history of type 1 diabetes is admitted with a blood glucose level of 600 milligrams per deciliter. What is the most likely diagnosis? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Thyroid storm. Answer: B. Hyperosmolar hyperglycemic state, HHS. Rationale: HHS is most commonly seen in type 2 diabetes and is characterized by extremely high blood glucose levels, altered mental status, and dehydration. While DKA also involves high glucose, it is typically associated with ketosis and metabolic acidosis, which is not seen in this case. Question 29. A 45-year-old female with a history of obesity presents with irregular menses and acne. Her testosterone levels are elevated, and her ultrasound shows enlarged ovaries with multiple cysts. What is the most appropriate treatment? A. Spironolactone. B. Insulin therapy. C. Oral contraceptive pills. D. Thyroid hormone replacement. Answer: C. Oral contraceptive pills. Rationale: oral contraceptives are often used as first-line treatment in managing elevated testosterone levels in PCOS to regulate menstrual cycles and reduce symptoms like acne and hirsutism. Spironolactone may also be used for hirsutism, but oral contraceptives are typically the first treatment option. Question 30. A 30-year-old female is diagnosed with hyperthyroidism and is started on methimazole. What is the most important side effect for the nurse to monitor? A. Hyperglycemia. B. Agranulocytosis. C. Hyperkalemia. D. Weight loss. Answer: B. Agranulocytosis. Rationale: agranulocytosis is a serious side effect of methimazole, which can cause a dangerous drop in white blood cells, leading to an increased risk of infection. Monitoring for fever, sore throat, and signs of infection is crucial. Hyperglycemia, hyperkalemia, and weight loss are not typical side effects of methimazole. Question 31. A patient presents with low sodium, high potassium, and low cortisol levels. What is the most likely diagnosis? A. Cushing syndrome. B. Addison's disease. C. Hyperaldosteronism. D. Primary hyperparathyroidism. Answer: B. Addison's disease. Rationale: Addison's disease involves adrenal insufficiency, leading to low levels of cortisol and aldosterone, causing symptoms like low sodium, high potassium, and hypotension. Cushing syndrome involves elevated cortisol, and hyperaldosteronism presents with low potassium and high sodium. Question 32. A 30-year-old male presents with sudden weight loss, tremors, and heat intolerance. His thyroid function tests show suppressed TSH and elevated T3 and T4 levels. What is the most likely diagnosis? A. Hypothyroidism. B. Hyperthyroidism. C. Cushing syndrome. D. Addison's disease. Answer: B. Hyperthyroidism. Rationale: the suppressed TSH and elevated T3 and T4 levels are consistent with hyperthyroidism, which presents with symptoms like weight loss, tremors, and heat intolerance. Hypothyroidism, Cushing syndrome, and Addison's disease would not present with these lab findings. Question 33. A patient is receiving treatment for hypothyroidism with levothyroxine. The nurse notes that the patient's heart rate is elevated, and the patient reports feeling nervous. What should the nurse suspect? A. Levothyroxine overdose. B. Thyroid storm. C. Diabetic ketoacidosis. D. Hypothyroid crisis. Answer: A. Levothyroxine overdose. Rationale: levothyroxine overdose can cause hyperthyroid-like symptoms, including elevated heart rate and nervousness. Thyroid storm involves severe hyperthyroid symptoms with fever and altered mental status, and DKA and hypothyroid crisis are unrelated to levothyroxine use. Question 34. A patient with a history of hyperthyroidism is being treated with radioactive iodine. What should the nurse educate the patient to do to minimize radiation exposure post-treatment? A. Maintain isolation for 48 hours. B. Avoid taking thyroid hormone for 1 month. C. Increase iodine-rich foods in the diet. D. Begin thyroid hormone replacement immediately. Answer: A. Maintain isolation for 48 hours. Rationale: after radioactive iodine therapy, patients are advised to stay isolated for 48 hours to minimize radiation exposure to others. Discontinuing thyroid medication or increasing iodine-rich foods is not indicated, and thyroid hormone replacement is not necessary immediately after the treatment. Question 35. A patient presents with a history of obesity, hypertension, and fatigue. His lab results show elevated cortisol levels. Which of the following conditions should the nurse suspect? A. Addison's disease. B. Cushing syndrome. C. Hyperthyroidism. D. Diabetes insipidus. Answer: B. Cushing syndrome. Rationale: elevated cortisol levels, along with symptoms of obesity, hypertension, and fatigue, suggest Cushing syndrome. Addison's disease involves low cortisol. Hyperthyroidism causes weight loss and heat intolerance, and diabetes insipidus presents with excessive urination and thirst. Question 36. A 22-year-old female presents with irregular periods, hirsutism, and obesity. Her testosterone levels are elevated, and an ultrasound reveals polycystic ovaries. What is the most appropriate treatment? A. Spironolactone. B. Oral contraceptive pills. C. Metformin. D. Insulin therapy. Answer: B. Oral contraceptive pills. Rationale: oral contraceptives are first-line treatment for PCOS to regulate menstrual cycles, reduce elevated testosterone, and manage symptoms like acne and hirsutism. Metformin can be used for insulin resistance, but oral contraceptives are typically the first treatment for these symptoms. Question 37. A 25-year-old male with type 1 diabetes presents with vomiting, rapid breathing, and confusion. His blood glucose level is 400 milligrams per deciliter, and his urine contains ketones. What is the most likely diagnosis? A. Hyperosmolar hyperglycemic state, HHS. B. Diabetic ketoacidosis, DKA. C. Diabetic nephropathy. D. Thyroid storm. Answer: B. Diabetic ketoacidosis, DKA. Rationale: DKA occurs in type 1 diabetes and is characterized by hyperglycemia, ketosis, and acidosis, leading to symptoms like vomiting, rapid breathing, and confusion. HHS typically involves type 2 diabetes and lacks ketosis. Diabetic nephropathy involves kidney damage, and thyroid storm is unrelated. Question 38. A patient with Cushing syndrome is receiving hydrocortisone therapy. What is the priority assessment for the nurse? A. Monitoring blood glucose levels. B. Assessing for signs of infection. C. Monitoring potassium levels. D. Assessing for signs of dehydration. Answer: B. Assessing for signs of infection. Rationale: corticosteroid therapy, such as hydrocortisone, suppresses the immune system, increasing the risk of infection. Monitoring blood glucose and potassium levels is important, but secondary to infection risk. Signs of dehydration are not a primary concern with corticosteroid use. Question 39. A 30-year-old male with a history of hyperthyroidism is treated with methimazole. What should the nurse teach the patient about the potential side effects of this medication? A. Watch for signs of jaundice and fever. B. Report any episodes of dizziness and headache. C. Increase fluid intake to prevent dehydration. D. Limit salt intake to prevent swelling. Answer: A. Watch for signs of jaundice and fever. Rationale: methimazole can cause agranulocytosis, which presents with fever and sore throat, as well as liver toxicity, which can cause jaundice. Dizziness and headache are not common side effects, and fluid intake or salt restrictions are not specific to methimazole use. Question 40. A 60-year-old female with a history of osteoporosis presents with a fractured rib. What is the most important nursing intervention? A. Teach the patient about fall prevention. B. Administer calcium supplements. C. Perform a full musculoskeletal exam. D. Provide pain management and prepare for a chest X-ray. Answer: D. Provide pain management and prepare for a chest X-ray. Rationale: the priority in managing a rib fracture is pain control, followed by assessment for other complications, for example pneumothorax, with a chest X-ray. Fall prevention and calcium supplementation are important for long-term management, but not immediate care. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.